Carolina Air Care started in 1986. We had, at that time, one helicopter, 5 crews. A crew consisted of a nurse and a paramedic, and of course, a pilot. We ran not as many missions the first couple months as we'd like, but we actually reached our break point pretty quickly and continued to do that and have done that ever since then. We were, at the time when we first started, because we started just a tad before mission, we were actually the only flight paramedics in all of North Carolina. And now we've got 4 helicopters, half a dozen ground units, critical care ground units, and something like 120 people. So we've grown tremendously over the years.
I started doing this job in 1997. And with Carolina Air Care, we have a specialty pediatric team. We take care of critically ill neonatal patients and pediatric patients up to age 18. We go to outlying hospitals and we stabilize our patients, and then we transport them safely, usually to UNC, sometimes to other hospitals. We make sure that they are stable en route, and we can do this by helicopter, ambulance, or medical airplane, fixed wing.
When I got here, I mean, the education that we have to go through to become a critical care transport or air medical provider, it's a challenge. You see the worst, you're eliminating about 95% of what you see in the ER. So the majority of what you're getting is, very sick patients, because we're taking ICUs to the patients. And, when we're landing in fields or, having to go to an ICU of a rural community hospital, and, we're, enhancing their care, with us just walking in the door with our clinical expectations and our practice what we're trained to.
People who like action, if you look at the profile for EMS people like action, but we don't really have as much dramatic action as one would expect. We do see some really great stuff. If you like that thing, this is a good job for you. We have some situations and patients you may never see on the ground. And I think that's what really attracts most people. They like the challenge. They want to see something that is a challenge to try to deal with. And that's the sort of people I think like the job.
People who are drawn to air care like to have a challenge, and they like to work autonomously. We have a very wide scope of practice within Carolina Air Care, so we're able to do a lot of things on our own independently that people who work in the hospital are not able to do. So you have a lot of autonomy to be able to treat your patients within our protocols. And I think people who come to this job are looking for that kind of a challenge.
The future is good, and it will always continue to be good, I think, because look at what's going on now with COVID. Things are going to happen. People are going to be sick, and people do things they shouldn't do, and they get hurt. And there are more and more people in North Carolina. We will have a need for this, I'm afraid, for a long, long time.
The future is going to be even bigger. It's going to keep expanding and providing more care for the patients of North Carolina, particularly for the pediatric team. I know that the Children's Hospital would like to see us transport even more pediatric patients throughout the state. So we're trying to grow our team. We're trying to recruit high quality candidates, and we're trying to retain the people that we have.
What we can provide continues to grow. We're constantly doing research and looking for further advanced practice out there. And I think with the direction of healthcare, we're seeing now our volumes are increasing we're not just going out for scene trauma, we're going out for scene medical. One of the misconceptions, I think, is because we do work for UNC, we don't always transport patients to UNC. We try to keep in mind and do what's in the best interest of the patients. This is the best kept secret at UNC Healthcare, is being able to work and being able to provide the care that we can do here with Carolina Air Care.
When you go and know that you made a difference in a patient's life and you did something that they needed to be done rather urgently, that was kind of complicated and there wasn't anybody around that could do that, and you were able to do that and provide that help for them and get them safely to where they needed to be, that always is very uplifting to me.
I learn every day. You know, I've been doing this I'm on my 29th year right now. Every day is different. You know, you're coming in, every call's different. So, you know, the challenge, the diversity, the excitement, the fun, you know, it's still there. It's still a spark, you know, and that's why you keep coming back for more. This is a phenomenal career to be in. It's rewarding and it's never ending.